We are live.
Namaste. This is 322nd episodes of Gyan Pravah, and it gives me a proud privilege to be a part of it. This is our last podcast for this year, but I know it's going to continue some or the other way. Learning is a process which we have learned with Dr. Sunita ma'am, our vibrant president. And today I know accolades to her achievements, whatever we have seen over the period of 1 year. January is still yet to come, and there are so many things lined up yet for us. So, having her in the frame, this is the podcast which has only gratitude for her. Why gratitude? Because academician is her forte. Everything is her forte. But what I have grown as a person, because now I'm talking about a session where there's an orchestration of midlife with hypnotherapy. Believe me, when she smiles, her presence around, there's some sort of positivity which we all have imbibed. Dr. Tarak, I welcome you with a note that this is one of the biggest opportunities which we receive the whole year round, that every 30 committee chairperson is allowed to choose their own faculty, do whatever you want to do. And one thing what Madam says, never say no. You do, I'm there as a backbone for you. So this is what we have held whole this year. I think gratitude is a very smaller word, but yes, madam, we have excelled with you with all the parameters here. We have done so many projects, Dr. Tarak, and there is a tinge of spirituality in everything what madam does. There is Arogya Yatra, which is another form of hypnosis, I would say, where we all sit together and really pray to God with madam's presence, her aura, and as she brings blessings of Gaganji Maharaj, Gagan Giriji Maharaj with us, I think we have had a very blessed tenure whole this year. Without standing much in ado, because I want to hear from Madam, she is here with us in this frame with
I
me.
was going to tell you, Archana, enough. Today is the day of you with Dr. Tarak, and we will keep on talking about each other so much. Tarak, thank you so much. And Archana has shared me your whole CV. It's very inspiring and outstanding. And I would like to come all the way to Baroda just to meet you physically and just to undergo hypnosis myself. I just want to have that experience. And Archana, thank you so much. Archana is one of my most dependable chairperson. Anything I give her, she comes out with a brilliant mind. She made me meet all your queens and kings of Barodas. And otherwise, it would have been very difficult. And you get to, widen your horizon, your thinking. So thank you so much. My protocol is I'm going out and I'll join the viewers link and enjoy both of you, your dialogues with each other. So thank you, Dr. Tarak, for giving the Foxy your valuable time. Thank you. And bye, everyone.
Thank you,
Bye.
Sunita ma'am. Thank you for the words of wisdom that keeps us going. And
Thank you.
bye, ma'am. So thank you, Sunita ma'am. And it's time to welcome our guest speaker for today, Dr. Tarak Bacharajani. Let me tell you that he was a dentist when I met him, and there was a conversion to a clinical neuroscience based hypnotherapist. His core expertise is in clinical hypnotherapy, mental health and emotional well being, psychosomatic and stress related conditions, anxiety, depression, trauma support, habit change and behavioral repatterning, youth counseling, emotional development, cognitive enhancement, and focus training, mind coaching, performance optimization, public speaking, professional workshops, corporate and institutional training programs. He has a vast experience of almost 20 years where he has developed strong foundations in clinical diagnostics, patient psychology, pain management, and long-term case handling. A deep insight between the mind, body, and spiritual connection has given him great parameters in the practice. He has also been uh, joined the Alpha Healing Center, where he has served as a core therapist for almost 6 years duration, collaborated with multidisciplinary wellness professionals, and provides holistic healing solutions to the patients which he used to cater over there. Conducted therapeutic sessions, played an active role in client education regarding brain mind interaction and self regulation techniques. Also, he has experience as a hypnotherapist and mind coach, where the support to the clients dealing with chronic stress, emotional blocks, confidence issues, and life transition challenges. Believe me, Dr. Tarak, midlife has everything what you have been dealing with, and developing an individualized group based hypnotherapy is a meat of the hour, I would say, where you have your academic excellence with us today. I welcome you as a visiting faculty to postgraduate program in clinical and applied hypnosis in the Department of Psychology, Maharaja Sayaji Rao University of Vadodara, and who has delivered numerous advanced instructions in clinical hypnotherapy, applied neuroscience, and evidence-based psychological framework to his students over there. Bridging the academic theory with real-world clinical and professional practice, he is also a professional speaker and trainer and conducted specialized sessions for corporate institutes and youth-focused programs. I think special population focus areas which you are catering to as youth and young adults, professional corporate employees, individual stress, physical conditions, and clients seeking emotional healing and personal growth. So, this therapeutic philosophy which you believe in, neuroscience grounded, client centric approach, which empowers the individuals to activate their innate ability for healing, resilience, and growth through conscious and subconscious alignment. I think this professional attributes which you carry with ethical and confidential practice, compassionate yet outcome oriented, strong analytical and diagnostic skills, excellent communication and presentation ability, which makes the client adaptable across sectional corporate and education settings. So I welcome you, Dr. Tarak, because hypnotherapy, as I would like to share with you, is my personal favorite thing when I talk about the midlife transition. We have been interacting through patients many times, but at this forum, I would like the world to know that before jumping onto the drugs or the pharmacological therapy, there is a bridging gap where this hypnotherapy can play as a real bridge to prevent the patient from actually being addicted to the drugs rather than developing that self confidence into that midlife transition. We all imagine a midlife lady sitting at home with a geriatric person to take care of and a teenage daughter or a son who's ready with his armamentarium, and you are actually become tired because of the hormones, your body, and there are so many changes yourself you're going on as a midlife person. Maybe a male or a female, I won't categorize it here because andropause is also a known entity. So when I talk that hypnotherapy comes as a savior, Dr. Tarak, from a clinical perspective, how would you define hypnotherapy and how is it different from common myths associated with hypnosis?
First of all, Dr. Archana, let me thank you from the bottom of my heart to invite me as a speaker on this platform. It's an honor. It's really an honor. Thank you very much. Now, coming directly to your question, hypnotherapy, in simple words, is a clinical structured use of focused attention and suggestion. Now, when I say that, it's a clinical process where there are an altered state of consciousness. In simple words, between waking and sleeping, when the conscious mind takes a backseat and the subconscious mind is open for work. So, this state is receptive states of mind where new patterns of perception, emotion, and behavior can be installed more easily. Of course, let me reinstate it's not mind control or making someone unconscious. In fact, most of the people are quite aware of what they are hearing and are in complete control. The only thing is they are deeply focused, relaxed at the same time, and in an inwardly absorbed state. You will have to unmute yourself.
What the movies used to tell us that there's something hanging and you say so jao, and things are going to happen. So it's not actually, it's basically a state of mind which is rather controlled by the therapist at that moment of time for some time to give you more relaxation.
Again, Dr. Archana, I don't control it. I just guide them.
Guide them. Sorry.
I just guide them. No?
So, is hypnotherapy a psychological tool, a neurological process, or both? And how should, like you pointed me at the right thing, how we medical professionals should understand it when we are prescribing to our patients?
It is actually both a psychological and neurological. But now, so with the new advances and the research which is going on in hypnotherapy and hypnosis, it is more tending towards neurological. When I say psychological, it is basically works through expectation, focused attention, belief, and therapeutic suggestion. But when I enter the dynamics of neuroscience, now today brain imagining has shown that hypnosis changes activity in networks involved in attention, self-awareness, and emotional regulation. Now, let me go a step ahead and use certain brain. We know today which part of the brain activity is reduced and how it is can be applied in our clinical setting.
So, what actually happens to the brain during the hypnotic state? You talked about in the lowering down of this thing. So, according to the neuroscience, what actually brain is undergoing at that point of time?
See, now with the new, as I said, the imaging techniques, there is a reduced activity in the part of the default mode network. What do I mean by that? Which is associated with, say, self-talk, rumination, and mind wandering. There is an altered activity in the anterior cingulate cortex and the prefrontal cortex. Now, just to make it more clear in simple terms, and right now we both are talking in the podcast. So we are totally focused with each other. Okay. Now, suppose, let's take it in your case, there is a huge explosion outside. What would be your first reaction?
Jump and go out.
Yeah, you join the podcast and you will run there. Now, in under hypnosis, when I say this part of the brain activity is reduced, so you will hear the explosion, you will not respond to it. Okay. So it also helps to bring stronger connection between the sensory and emotional areas. Now, this is one way of putting it where you are more absorbed in it. If I go a little bit more deeper into neuroscience, can I do that, Dr. Archana?
Yes, please, please.
The more brain regions which are involved. The second is the dorsolateral prefrontal cortex, which again, somewhere it's connected with executive control, attention, and decision making. What I just explained you about the anterior cingulate cortex, it's basically for conflict monitoring, also very useful in pain modulation and emotional resilience. Now, there is a part in the brain known as the insula. Now, that is the trump card of hypnosis, which connects the brain with the rest of the body. So it is very useful in interoception, body awareness, and emotional intensity. Last but not the least, as we are just touching before we started, the spiritual aspect. It also has its effect on the posterior cingulate cortex, which is responsible for our individual awareness, or the I, the ego, whatever you may call it. So once this goes down, you lose your sense of personal identity and you are sort of more, into the universal awareness. So yes, putting all these three together forms the basic neuroscience of hypnosis.
So when I talk about this, it was a very clear understanding. I think going to the parts of the brain, understanding that explosion example was really something which really made me understand it properly. But can hypnotherapy influence the autonomic nervous system, especially stress-related responses? Because nowadays, I think stress is the major thing which is eating everybody from inside. And when we talk about gut health, mental health, anything, I think stress is the triggering factor. So how
very true,
it related together?
Today, the way the lifestyle is going, especially in women, if I see, they are the actual multitaskers. Let's be very clear about that. So now hypnosis has a direct, it makes a shift in the autonomous nervous system. So now research has shown that the variable heart rate, they show that it reduces the sympathetic nervous system activity and it enhances the parasympathetic, nervous system activity, which leads to relaxation. Now, clinically, what it correlates to is reduce slow breathing, relaxes your muscles, and your heart rate reduces and improves your stress resilience. Now, if I go slightly on the gynecology part of it, reduces pain, hot flashes, improves your sleep, irritability, which are amplified by the chronic sympathetic overactivation. Hypnosis helps you to calm this.
Very true. I think you talked about insomnia and hot flushes, which is the most common complaint when the patient comes to us, where we do suggest them behavior therapy, hypnotherapy, and all these things which would help them. The important thing which comes in midlife is that why this insomnia occurs, there is pain. The pain perception actually increases. And can we modulate this at a neurological level? If yes, then how can we do that if I have to prescribe? Like pain and tiredness is an integral part of midlife and it actually starts full blown, especially in the females who have not given yet put time to the exercise, right? I would say LSM, lifestyle modification. So suddenly there are joints aching, everything aching, and you're not able to sleep, you're not able to perform as you used to. So is there a part of pain perception going down or being better with hypnotherapy?
Yes. We use the term, we call it hypnoanalgesia.
Okay.
Now, it works directly on the pain pathway. When we used to learn in anesthesia, anesthetics, the pain, the gate control therapy. Now, here it works, as I said, on the anterior cingulate cortex and the prefrontal cortex. So it is involved in how pain is evaluated and it gives meaning to it. So once that activity goes down, so their level of pain tolerance, it automatically goes down to a great extent. So now, clinically, if I say hypnosis can be used for procedural pain, chronic pain, perioperative pain also, to that extent, labor pain. So especially people, women with dysmenorrhea, chronic pelvic pain, uh, they have certain anxieties because usually, as you say, when anyone, especially now, if we are talking with women, about women, they have undergone at midlife, in their mid 40s, a certain amount of married life. There's always stress. If I more define it with the husband, the in-laws, the raising up kids, and if the lady is working lady, the stress is even more to fulfill the expectations and her own expectations. And at the same time, when once there is a stage in everyone's life, you come at a plateau. Enough. So it's that moment where hypnotherapy, when it can be introduced, it can really help the person to make, not only first basic to relax, but also bring down their pain control on a psychological level, emotional level, and ultimately the physical level.
The pain can definitely be helped if you're right time you choose the proper modality to at the right time. Probably that would help them the best. As you talked about post-operative, even the labor pains can be made a relaxation kind of a thing. So that's a very good insight, Dr. Tarak. If I talk about the midlife, all these things start with the hormonal turbulence. We are losing the happy hormones, estrogen, obviously. So the happiness is a component which is controlled by the hormonal disorder, which is always occurring in the body of a female. So is there any way out if I have to prescribe a patient, go for hypnotherapy, maybe 35 plus ladies where the hormonal turbulence actually starts? So I think neuroscience would be able to explain it better.
Yes. So basically, there is what we call as a neural overload at that age. There's already a neural overload, an emotional overload. So as we all know, it's the cortisol, the stress reactivity goes high. Now, in this, there is a simple cycle. The thoughts, your emotions affect your nervous system. And once that is triggered, it triggers your hormonal system. So now, once the hormonal system is triggered, there is a lot of imbalance. And then your sleep is affected. There's a mood swings happening. Now, in that, once we start working with the client, gradually as they start practicing the sessions, I mean, just to clarify, we do a session with them in house or maybe online that is recorded and that is given to them for practicing. So the more they touch that states again and again, there is a definitely changes at a neural level. So there is an autonomic balance which makes the hormone related symptoms more manageable. See, I will not say it's a cure, but it's an adjunct therapy. And certain patients respond way better than some others, but it definitely helps them in a neuroendocrine modulation and via stress reduction. So it works on the HPA axis. You're mute, Dr. Archana.
Yeah, no, that was a very nicely put up, Dr. Tarak, because many of the ladies do suffer from many things and they shy out. They don't come and tell that they are suffering actually. So when we get hold of them in the right frame of right time span, probably these things can be handled so well as you are describing it very nicely. And the other part which you said, the female is a multitasker. So that is true because the course at home, the course at the office, and your emotional intellect, the personal intellect, everything certainly fades out. There's a brain fog. Should I term it as neuroplasticity? I don't know how to tell it. There's a neuroplastic type of a component where the lady is not able to adjust or cope up with whatever is going around. So how do you match this word with the midlife women and how can we help them?
Dr. Archana, neuroplasticity will be like making new neural junctions and connections in the brain. But here, what's happening is there is many times, as you rightly said, the lady is exhausted. And I have seen in most of our ladies, and possibly even in out of India, a lot of ladies do that. They give themselves the least priority. Now, in this case, what happens is, now I do suggest, of course, with hypnotherapy, you try certain hobbies where again new neural junctions are formed. Try new habits, change your habits along with hypnotherapy. Exercise is the best thing. It can be yoga, it can be gymming, it can be Zumba, Now, when they undergo all these things, the brain starts forming new neural junctions and they feel more fresher, more active, which they had, they sort of had missed in the last few years. So it's like taking back them to their 20s, which they were so active about. And once they start feeling that goodness about them, and what we do with hypnosis is guided imagination, powerful suggestions. So once you use this repeatedly, it creates a different form of, insight into their mind. So building new neural patterns, which ultimately, it acts as an amplifier for a healthy lifestyle.
I think that's a very, very important point. You said repeated exposures to happiness or sadness. The sadness component automatically starts waning off, like it's going to happen. And when you are repeatedly exposed to that happy quotient, I think that is giving you extra boost. Like you start reflecting joy from inside. I think that's a very good boon with hypnotherapy where people can practice and get benefited too. Coming back to a common gynecologist like me, mind body loop is a word which I want to trap you into that. So how do I exercise this mind body loop to myself or to my patient? Because we all know, as a gynecologist, we know what is happening. But as a patient, sometimes it's a very difficult thing to go around this loop and come back to the existence again. So,
And because Dr. Archana, imagination is one of the most powerful tool we are endowed with. Now, most of the time, it goes on the wrong direction. Now, what hypnosis does is it redirects it into the path which elevates you. As I just repeated, it increases pain's perception. And because it works on that part of what's known as the insula, which connects, the brain and the body. Now it increases your sleep. Once it increases it improves your sleep. Now, when I mean improves your sleep, the deep sleep cycle, especially the deep sleep cycle, it also increases the mood and also your coping mechanisms. And the symptoms and all those things starts feeling lighter. It amplifies the autonomic reactivity and also decreases the palpitations and irritability which they've been feeling. So it breaks this loop by down regulating the parasympathetic tone, the sympathetic tone. Now we teach our clients or patients to shift from a panic mode or a catastrophizing mode to a calmer and a more adaptive appraisal. And we teach them subconsciously with our sessions, giving them hypnosis tools. We teach them self-hypnosis for daily use so that they can calm themselves instead of depending on certain external interventions. And then once they start getting used to this, of feeling good again, that itself becomes a motivator in practicing self-hypnosis again and again.
That's a very good idea, actually, giving them the tool in their hands to help themselves. Because this changing world, I think self-love and being dependent on yourself is the key to live a most happiest life. Because I feel when a lady is happy, I always say if Home Minister is doing good, the state of affairs are all well
Yes,
balanced.
everything is settled.
Yeah, it's touching everything. And Dr. Tarak, moving further to the discussions, that the midlife comes with package of many other gynecological disorders, even PCOD. I would call it as PCOS, which is a long-term sequel to whatever has happened in her adolescent and the reproductive age group. And then gynecological cancers are there. There is comorbid conditions, diabetes, hypertension to name, which is very rampant. And simply a recurrent UTI patient who is suffering from pain and everything. So all these disorders may be something else which I don't want to enumerate, or maybe the list is very long. But do the other gynecological conditions can also be benefited? Transition, obviously, we know it is a very healthy if you go ahead with that.
Yes. I'm going to go a little bit away from the neuroscience and into psychology. Now, what we have observed and studied, that over the period of time, see, whenever a person faces sad, traumatic, when the person sort of tends to, or rather, if I put it very simply, the brain tends to take a snapshot of that event with that unresolved emotions.
Exactly.
And it permanently stores into your subconscious mind. Now, it sort of piles up day by day, year by year, month by month. So there's a time when it's an emotional overload, and that sort of starts seeping at a physical. Once it is at an emotional level, now it sort of seeps at a physical level. When what you just described, it's manifest at a physical level. Now, the problem is not at a physical level, it's at an emotional level. So if you can, with hypnosis, we allow them to release those emotions, those trapped emotions. For example, they have negative emotions towards their in-laws or maybe husband. So under hypnosis, in trance, we allow them to release them, which actually they are not able to do that in reality. It's difficult. Even, express certain things which they are not able to do in reality. So once they are able to do that, a lot of emotions starts flowing. I put it in a very simple terms. What are emotions? They are energies in motion. But when they are stuck, they stagnate. And when they stagnate, they produce issues. So once these emotions starts moving, we have the ability to heal ourselves at a mental, emotional, and the physical level. And there is a lot of research right now going on in this region and how an emotional release can heal you also at a physical level. I don't know, I'm going to go a little bit on a personal track. You had referred me a couple for, I think it was erectile dysfunction. Now, what it turned out to be a case of vaginismus. And when I worked with the lady instead of the guy, and she became more and more relaxed, and we can use hypnosis to do that, their life became very smooth. You know, what they were struggling, and it became very smooth. Then also menstrual problems, as you said, it helps them in reducing their pain, accepting the pain threshold. One more thing, if you don't mind, I'll go to slightly fertility or rather, pregnancy.
Yeah, they're very true. This is a subject which we should discuss because now midlife is the new time to marry. So people don't want to
Yeah.
have kids till 40. But it's like now 20s is the 40s, I can, but the 40s is the 20s. So that's a very apt subject. Please go ahead, sir.
Today, you must have seen that a lot of young couples, even young couples, I'm going to start from there, are not able to conceive. Now, I was taught by most of them were medical professionals. And one of them was a very senior gynec. And what she found out in her 40 plus years of practice using hypnotherapy in gynecology was either both or the lady had a subconscious block which was preventing the conception to occur. If that block can be resolved with hypnotherapy, the conceptions occurs naturally. And she has treated a lot of cases. I have up till now treated one. The down part is you can never take the credit for it.
But when you treat the right person, probably it is going to propagate in a better way. So that was very nice example you said. But coming back to our midlife, that menopause is not just hormones, it is neurological as well. So could you explain the connection to our listeners that this neurological symptoms and menopause linking together in the light of hypnotherapy?
Sure. See, I'm speaking in front of you, so I'm not going to go detail into it. Menopause is not it's basically a brain transition. It's not totally an ovarian thing. Now, estrogen and progesterone interact with neurotransmitters like serotonin, dopamine, GABA, impacting mood, sleep, cognition, and thermoregulation. Hypothalamus, which is responsible for temperature, sleep, and appetite, it becomes very sensitive to hormone shifts and stress. Now, it is here where hypnosis, when this fluctuates, there's a decline, brain is responding to hot flashes, night sweats, mood swings. We use hypnotherapy, and it has been actually recently the paper has come out that clinical hypnosis can significantly reduce the frequency and severity of hot flashes to 50%, and improve the quality of life. And what we do is we allow the client or the patient, to lower their automatic arousal and modulating the hypothalamic sensitivity, which ultimately reduce anxiety, the catastrophic thinking they develop about their symptoms, improve sleep, which also reduces the emotional burden. And also we allow them to create a belief that it's a part of the aging process. See, today what's happening is the acceptance level has gone down. How can this happen with me? There is a resistance. There is a subconscious resistance towards certain changes at a physical and emotional level. So once they are able to sort of accept these changes, with hypnotherapy, we allow them to make peace with it, change their lifestyle. And once they start, there is a acceptance, there is a relaxation, there's also, you know, the hormonal balance, which is sort of near, I won't say total, but definitely it's helps them a lot in that sense. Now, at a biological level, there are the fluctuation, decline in estrogen affect neurotransmitters, but with hypnotherapy, the calming is more to the threat response circuits. Oh my God, I'm facing this. What will happen? This is where it helps them to, it reduces that response. It reframing, as I said, the beliefs and strengthens their emotional regulation and self compassion at a subconscious level. And somewhere they feel that they are completely normal. Of course, we do give them exercises, so that also helps them to, ultimately it's how much body aware they are. That much they are, I'm sure you will agree with you, in today they are so much aware of their body. So that acceptance is much, the transition, we make it more smoother, symptomatically and psychologically.
I think acceptance is the right word which you've used, because the face of denial is there. Ki it's not, how can this happen to me, was a sentence which clicked me the most, I would say. But as we go on like net and everywhere, keep on manifesting, keep on manifesting. But sometimes person is tired to manifest also. So probably there we need Dr. Tarak to tell us, no, this is right. You are beautiful too. With some extra kg of weight also, you're looking good and you're doing good. So that's the insight which hypnotherapy offers us, making you feel not self-conscious but self-love, to exaggerate that feeling of coming in terms with your midlife transition, I would say it that way. So that's very true. So I think the subconscious mind you have used multiple times when you were talking about it. So this subconscious mind does play in the severity of the symptoms. So you are basically targeting it. I mean, how do you go about it? How do you convince your patient that I'm going to do this to lower down your threshold of hot flushes, or maybe menstrual irregularities there? There are so many symptoms. She may not be able to walk to your clinic properly, but when she leaves after a few sessions, the walk is different. So that subconscious level, how do you go and align it actually, I would say?
The truth, what I share them is the basic truth, what is like the reality, that your subconscious mind cannot differentiate between a real experience with emotion and an imaginary experience you create with repetition, which is fueled by emotion. If with hypnotherapy, they can repeatedly create an imaginary experience with emotion so powerful, it will override the real experience. I'll give a very simple demonstration or example. Many times, just a thought of a favorite food, Dr. Archana, doesn't it bring water in our mouth?
Yeah, yeah. I
Now,
imagine pani puris all the time.
so, it's just the thought of it, your salivary glands are activated. And also, we have found out your digestive juices are also start secreting. But there is no food actually. The same thing in a hypnotic setting, we use it in a grand way. So if I come down to the brain learns to interpret the first sensation of say hot flashes with less fear and struggle. The motor and the autonomic responses are replaced with practice calm responses, which we teach them with repetition. And over regular practice of hypnotherapy sessions, they can reduce both the intensity and the distress associated with hot flashes, which is actually shown in our clinical trials.
So I think that is linking yourself with self-meditation and thresholding the response, like controlling your own response to the situations which you described very nicely, Dr. Tara. So one question which I am not targeting actually, but probably, is hypnotherapy safe for everybody? When especially the group which is very sensitive, and a taboo that I'm going for some therapy. So they need to understand it is safe and completely, not that movies make us imagine something is happening going absurd with you.
Yeah, it is not Vashikaran.
Not Vashikaran. Exactly. You got me
No.
right.
Clinical hypnosis is generally very safe, provided. Now, I'm going to use this. You are in a hands of a professional trained hypnotherapist. Not someone who has done a certificate course, but done a postgraduate course. That's one. Second, I will only name the contraindications because that's are very few. The rest all are applicable. The first contraindication is where there are active psychosis or disorders. Active. Also, there is a heavy dependence on a substance without stabilization. So that person is not in any state to go into that state or be receptive. And the last is when the person is either in a very severe clinical depression with suicidal tendencies. Now, why I'm stating this is under hypnosis, when their subconscious opens up, Dr. Archana, I, as a therapist, cannot control, nor my client or a patient can control what's going to come out. So when I say suicidal tendencies, they have sort of suppressed it for some time, but under hypnosis, they may resurface up. So these cases, and of course, we need their informed consent. If they are not ready, so I am not prepared to touch my patient or my client. So these are the few things. Rest apart, everyone can take benefit of hypnosis, and it's low risk, minimal sessions under ethical boundaries with proper, and the best part is, as I said, they can use it on themselves. That's the most beautiful part.
So I think it is not Vashikara, it is keeping yourself into alignment with your own changing self. That's what hypnotherapy does to us. You have worked with the Alpha Healing Center, Dr. Tarak. There are many ladies who fall prey to many substance abuses, especially males in the late 40s. I think whatever data I went through, there is a tendency of female to speak out. They may be multitasking, they can fight the emotions out, they can take it out on anybody. There's a sandbag called husband everybody has, or a boyfriend, or maybe somebody, a good friend. But when it comes to males, I think there's a suppression of most of the emotions, which is least talked about. You always talk about midlife women, midlife women. There's a man who's undergoing a retirement phase, planning of the further education of children because he's already 40 and the boy or the girl is entering into 9th or 10th standard. So these things all come back together. They are left with nothing rather than suppressing their own requirements, and then they tend to shift towards the substance abuse, which you must have seen in your clinical practice. So are these things like they are able to return back? Do the rehab does work? Does the hypnotherapy really help them? Because in this today's world, I think everything is available at the drop of hat if you want to indulge yourself into something. A very vital question, which is not a taboo system.
I'm glad you touched this question, Dr. Archana, because yes, as I said when we were talking with Dr. Sunita, that Alpha was a revelation to me in a lot of ways than one. And what I have found out is, just clarifying, usually people under 25 are more into substance or drug abuse. About 25, mostly is alcohol. Or maximum, mostly alcohol or maybe weed. But as you said, what happens is a person is not suddenly becomes an addict. He may be a simple social drinker. But when such situations are overwhelming, and there is a trigger in the house or somewhere else, and it is that time he takes a drink or something and he feels good about it. So the brain makes a connection. So he's tempted more to go and sort of so numb that pain, that psychological pain, by having a drink. And that's once starts becoming over and over again, it becomes a habit which becomes a addiction. Now, I won't claim there is. I was working with a team of psychiatrists, psychologists, and we as a team have worked and got a lot of people out of addiction. A lot of their family backgrounds also matter, but mostly midlife, either mostly it's the family situation which we have to work on. If that can be resolved, it's more of a family therapy rather than an individual therapy.
Exactly.
If that can be worked upon, and if the family is receptive to all these things we are working on, yes, we had seen results, beautiful results.
So I think a group or the mass hypnotherapy is something which we need, because whenever we gynecologists also see a ANC patient, a delivery patient who registers with us, I always say bring everybody. You should know your gynecologist, because at the mid of the night somebody talks, maybe the way we respond, they should understand physically this was the person who was talking to them and this is what is meant for. So I think a family network treatment is very, very important key therapy when we talk about hypnotherapy, because everybody cannot be given the pharmacological support. But yes, hypnotherapy or the behavioral or the cognition, intellect, what you're trying to tell us is a must for everybody, because a lady or a man in a midlife is not just a man, it's a family around which is pushing their limits to achieve what is in their capacity or not. Because everybody won't run like maybe a deer, some may be like a not a lion just sleeping out there, not a goat. Everybody has got his own diversity to climb the ladder or take the path. So matching is something which we need to put that network into everybody. So Dr. Tarak, effective talking about the subconscious mind. I really enjoying this discussion. Taking a step forward, uh, as this is the question which I always ask everybody to the wits to it. Any funny or the incidents which has touched you and you still have in your mind, without taking names? Anything which you would like to share, which gives you a kick to go further, probably, or a case scenario where you found that it
Funny,
was.
when you put it funny, Dr. Archana, I can share only one funny. There are a lot of funny things.
Yeah.
And I'll share only, it's a very simple. I was taking a group session in Alpha. And because that was it was quite early in my tenure at Alpha. And we used to have two group sessions, one non-English and one English. So I did a group session with non-English people, and the session was about once I induced them into a hypnotic trance, I told them let their subconscious project the mischief they'd done in their schools. So we had this 62-year-old gentleman, and after them reorienting after the session, I always ask their experience to share it with the crowd. And this gentleman was smiling from ear to ear, literally. So I told them, Chacha ji, kya baat hai? Itna हंस क्यों रहे हो? Yes, तो मजा आ गया. I said, what happened? Share it. बोले मैं 7वीं में था और उस समय they used to have this wooden foot rulers. उससे मैंने अपनी टीचर की स्कर्ट खींची थी.
Oh God.
And I tell you, Dr. Shana, this happened in the morning around 11:30. By the time I left, you were still in that mood. That one good memory changed his whole outlook, at least for a day, for the whole day. And also, if I go a little bit, I have seen clients release their guilt, pain in one session many a times. And when they come out of it, they feel like, oh, it's gone forever. So yes, this is the only thing I recollect right now when you put it. But there have been a lot of such things.
Yeah. Unarmed questions, so it has to be spontaneous. So I think the childhood traumas are something which is very, very, very important aspects, which Even the person can be having a very, very sound position in the society, very intellectual person, but some childhood traumas deeply seep in. And by this type of emotional upbringing, I would say, with the help of hypnotherapy, probably they are benefiting themselves in a larger, as you say. The guilt is something which, how do you address the guilt? Because many of the ladies who are working, they have a guilt that they have not given enough time to the family. They do come and tell us, okay, like probably I wanted to do this much, but I was not able to do. So this guilt is something, if you can make them guilt free, I think you're getting my point. How do you teach them to come out of that framework?
See, basically, Dr. Archana, I approach them in such a way. Usually, we tend to overlook our achievements, our things we have done, see them. And ladies tend to do this more. Now, in such, I subconsciously bring out those things which they have done for their family. Literally count them subconsciously in a hypnotic session. Mm-hmm. And when they realize, because it's happening subconsciously, and I'm not suggesting anything, that's the beauty of hypnotherapy. It's they who are seeing it themselves. So they start realizing, and I give these post hypnotic suggestions that look, you are doing your best. You are no less. And this is during the session, and they realize it. They start feeling it. When they keep repeating the sessions, more I give that, the more and more such achievements and the work you've done for your family will resurface. But slowly, they start realizing, no, that I am doing enough. At the same time, I make them realize it's time to work on yourself. You've done enough. Now you're free. Kids are grown up. Husband is managing on your own. Now start investing time for yourself. So we use what we call as future progression for motivation people, anyone. So I said, today you are like this. Now I want you to see yourself 1 year from now, how you want to be, how you want to look, how you want to feel. Look at your future self. They are able to do that, and I sort of unite them together.
That's very true, because when I see the patient, sometimes there's a word known as journaling. I also suggest them start writing down. So once you start writing down your problems or your achievements, everything becomes very, very comfortable. So thank you, Dr. Tarak. It was like a very much eye-opening session, I would say. Just a last question. What is the message would you like to give to our midlife women and men both?
Okay, midlife is not a crisis, it's a phase. I think even I have undergone that, so I can say it with confidence.
So nice.
I changed my profession at the age of 41. So
I was just coming to that, you can always, Dr. Tarak has been an inspiration from a dentist to a hypnotherapist. So your passion can lead you somewhere. Now he is like completely invested in that, and you're more happy doing this. So that's what brings happiness to you. Please catch it and never let it go. That is the punchline which I think we all want to convey. So before ending to this, just to sum up, that your subconscious mind is limitless. Try to touch that, take help as and when required, because hypnotherapy is no more a vashikaran. It is something which gives you a connect to your inner self, which I think today's era where speed matters, where competition matters, where peer pressure matters. I think I'm talking about the girl who is 15 years to a girl who is late 50s or maybe 60s. So that all connection comes within itself. Probably Dr. Tarak and the team of hypnotherapists available pan-India nowadays. It's no more like it is available at your doorsteps. Go ahead, catch hold of somebody who can help you come back, sail through all this transition which is happening to you. Because I think we all agree together, because you are worth it, and your worth is something which is limitless. Nobody can define what you can achieve by getting hold of your mind and your composition into one level. Thank you, Dr. Tarak. It was a great.
I just add one thing,
Yeah,
Dr.
please do.
When people use the word therapist, I always I said, no, you are not coming for therapy. Take it like a life coaching.
Yes.
Just change your perspective. I am not here to do any therapy, and I don't counsel as a specialized clinical hypnotherapist. I don't counsel. I don't do any behavioral therapies. I'm just allowing your strength to resurface. So take it like a life coach, and everybody needs a life coach.
Yes. Thank you, Dr. Tarak. And I think our president, Dr. Sunita ma'am, our group of vice president, our group of chairpersons, this is my last podcast for this year. So I take the opportunity to thank everybody, because each and every individual, even if you look around yourself, they teach you something. Somebody's smile is good, somebody's way of coping up with the stress strategies. I mean, talking about our own president, you just met her. If there is something which you're not able to do, there's a sudden push, better you do it, you'll do it this way. That was just shifting a dot from here to here. And that matters the most to you, and you suddenly try to accomplish. So look upon your ideal, look upon the people around you. Try to have the specs which give you the beautiful view of yourself. Mirror is no longer an enemy in midlife. So with these words, I and a touch of gratitude to Dr. Tarak for joining us on this viable platform. I think hypnotherapy and cognitive behavior therapy and other modalities are there to stay, and it is an ancient therapy which is now being recognized by the Western world with forms of data and everything. So we should look forward for a better future, better health, better accomplished, I would say. On these words, thank you, Dr. Tarak. Thank you, Dr. Sunita ma'am. And thank you, team,
Thank
for
you for inviting me.
giving me this opportunity to share my views, and had a really lovely time today, Dr. Tarak, with so much of insights. I think I'll be rechanting my subconscious mind for the whole of the journey remaining till the coming morning, and probably I'll wake up with a better sleep and better human being. Thank you so much. Good night to everybody. Have a nice dinner. Enjoy yourself, because New Year is here. We try to make it more compensation, no resolutions, just be free. A very happy 2026 to everybody over here, and see you soon. Thank you. Bye bye and good night. Thank you, Dr. Tarak. Thank you, team, for the wholehearted support.
Thank you, support team. Thank you.
Thank you. So, team, we can stop recording.